Welcome back. We turn to our health spotlight now and welcome in Wish TV medical expert and former U.S. Surgeon General, Dr. Jerome Adams. Dr. Adams, always good to see you, sir.
Good to see you, Phil.
There are really two issues driving the health discussion today, and let's start with COVID-19, if you don't mind. The FDA has approved, as you know, vaccine boosters for children ages 5 to 12 years old. So that leads me to two questions. First, what's your recommendation on when to get that shot for children? And secondly, when are we going to get a vaccine for children under the age of 5?
Two very important questions, and I'll start with the first one. When should you get that booster dose? The FDA says you should wait 5 months after your last dose, your second dose of the Pfizer vaccine that you got previously, to get that booster dose. And I do recommend that parents get it. If you've already gotten the two, get the third. It will significantly lower the chance of infection. It will slightly increase protection that your child has against hospitalization and death. And again, it's something that I've done for my own family. As far as under 5, that's a separate conversation. We know Moderna submitted their data to the FDA. It's under review right now. The best guess that we have is mid to late June that the FDA will have a decision about the Moderna data. The Pfizer data for vaccinating kids under 5 still hasn't been submitted yet. So we're still in the dark as far as where Pfizer is. But Moderna, parents are hoping for mid to late June, in the next 3 to 6 weeks, we'll get an answer.
All right, we'll keep an eye on it. Meanwhile, the White House has scheduled a COVID-19 briefing tomorrow, the first one that we've seen in a while. Now, is this a sign that we're in for another surge or wave in cases, in your opinion?
Well, we are in the midst of another surge of cases. We're seeing cases go up precipitously. We're starting to see hospitalizations creep up also, not to the degree that we had with previous surges thus far, presumably because many more people have some degree of immunity from prior infection, and many more people have gotten vaccinated and boosted. I think the White House is going to talk about that increase in cases. They're going to talk about the fact that they predict that we're going to see significant numbers of infections in the fall. And they're going to talk about the measures that they've undertaken to help people protect themselves. They just released another round of free tests. So you can go to covid.gov and get another 8 tests if you've already gotten your previous 8 tests. It's good to keep them around the house in case you have symptoms, in case you're traveling, in case you're going to visit someone who's vulnerable. All sorts of good reasons to have a free antigen test around the house.
That said, Dr. Adams, are you worried about next week's Carb Day and Indianapolis 500 being a possible super spreader event?
Well, we know with cases going up and people coming together, the virus is going to spread. There's absolutely going to be spread that goes on at the race and at Carb Day. And so what I want people to know is how to best protect themselves. Assess your own personal risk. Understand whether or not you have comorbidities, obesity, whether or not you've got lung issues, whether or not you've got high blood pressure, the things that put you at higher risk for a negative outcome from COVID, or whether you're living with someone who's immunocompromised that you don't want to take infection to. And if that's the case, don't go. If you do decide to go, consider wearing a mask when you're in crowded spaces. And please, make sure you get vaccinated. That's the best protection, vaccination and boosting, that you can take to protect yourself. I go to events myself. I'm vaccinated, I'm boosted, and when I'm close to people, I wear a mask. So that way I'm mitigating that risk to myself and my family.
One more issue before I let you go, Doctor, and that's that shortage of infant formula in the United States. The president has announced a plan to help ease the shortage, as you know, but the shortage will still last for a couple of weeks. So what's the message for families needing formula right now?
Well, we know that there are shortages, and in some places severe shortages of formula for parents because of supply chain issues and because of a recall that happened. They're working on it. Right now, we want parents to understand you should not dilute your baby's formula because it can change the nutrients that they're getting and the electrolytes that they're getting. You should not order formula online if you don't know that the source is reputable, because there is counterfeit formula out there. Talk to your doctor. Talk to your provider. The good news is the Biden administration is going to try to lower the cost for people so that they can switch over to different formulas. And some women can actually increase their breastfeeding also. It's not an option for all women because breastfeeding is tough and it's not an on-off switch. But there are lots of options out there to get you through this shortage. Just make sure you talk to your health provider. Don't do something that could harm your baby.
All right, hopefully we get this thing figured out soon. Dr. Jerome Adams, always good to see you, sir. Thank you for joining us tonight.
Thank you.